Yung son. Ga-bleeding na ka, sir. Anak ka na ko, wala kayo na yung sakit.
Sorry daw po, kasaba. High blood mo ko. Ganahan na dyan ko mo paibot.
This is what will happen if there's no interprofessional approach to patient management. And not only in this field, but to every healthcare field there is. So do you know what this interprofessional approach to patient management is? If not, come and let's learn. Interprofessional approach to patient management is defined as the provision of comprehensive health services to patients by multiple healthcare providers in various fields working collaboratively to deliver quality care within and across settings. This has great potential to improve patient safety and quality of care. In other sense, collaborative practice happens when multiple healthcare workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care across settings, and this is according to World Health Organization. This aims to improve how patients experience care in terms of quality, efficiency, and overall patient satisfaction. This also aims to improve the health of populations and reduce the per capita cost of healthcare. The members of an interprofessional care team are the patient and his or her social support, like family, caregivers, and community, the dental team, health professionals, and other professionals. Together, these professionals from varying fields work together and uses teamwork and collaboration in understanding of the whole patient and his or her healthcare needs. It's always necessary to provide optimal healthcare, specifically like in dental field, for example. It is essential that the dentists collaborate with the other members of healthcare team to develop a dental treatment plan with goals that are aligned with the overall treatment goals of the patient. And that ensures that treatment delivery is coordinated with the overall management of the patient's diverse health problems. Interprofessional care requires knowledge and understanding of how to successfully incorporate this to the field. Let's hear this knowledge of the different aspects of interprofessional care from the students who are currently studying its principles. In order to achieve success in interprofessional care, we must also learn from errors. The patterns of errors that exist in the healthcare setting are just the same to the patterns of errors that exist in other settings. If errors occur in the healthcare setting, it is the patients that will suffer. These errors occur because of either actions do not go as intended, or the intended action is the wrong one, or when making a mistake, which is the intended action, is actually incorrect. Situations like inexperience, shortage of time, inadequate checking, poor procedures, inadequate information are associated with an increased risk of error. There are also individual factors that predispose students and other healthcare workers to errors, such as limited memory capacity, fatigue, stress, hunger, illness, and language and cultural factors. But there are ways for us to learn from these errors through reporting incidents and analyzing the root cause by following the London Protocol for Investigation process. Fortunately, we can limit potential errors from occurring through avoiding reliance on memory, simplifying the processes, standardize common processes and procedures, and using of checklists.
Managing clinical risk in varying fields, there are simple four-step processes commonly used.
First, identify the risk. Second, assess the frequency and severity of the risk. Third, reduce or eliminate the risk. Fourth, assess the cost saved by reducing the risk or the cost of not managing the risk. Healthcare is inherently risky itself, and although it is impossible to eradicate all risk, there are many actions that can be introduced to minimize opportunities for errors, and this is to understand manage clinical risk by first, knowing how to report known risk or hazards in the workplace. Second, keep accurate and complete healthcare records. Third, Know when and how to ask for help from an instructor, supervisor, or appropriate senior healthcare professional. Fourth, participate in meetings to discuss risk management and patient safety. Fifth, respond appropriately to patients and families after an adverse event. Lastly, respond appropriately to complaints. I'd like to make an emphasis also on the importance of both students, professionals, and every member of the team to report the incident of error so that steps can be taken to avoid similar incidents in the future. Even we students observe some senior staff not reporting, we should keep in mind that a health service with a culture of reporting is safer than one where no reporting occurs. Valuing reporting culture not only will avoid errors but also ensure patient safety.
The application of quality improvement methods by healthcare providers has been shown to significantly improve patient care and minimize errors. The implementation of these methods are put into practice by teams of individuals who collaborate and follow predetermined procedure to address and avoid problems.
PDSA, or the Plan, Do, Study, Act cycle, shorthand for testing a change, is a 4-step process in carrying out a change. By planning it, trying it, observing the results, and acting on what is learned. What we are trying to accomplish must be clear. It is also important to know whether a change is an improvement and what change can we make that will result in improvement. It is encouraged for students to confirm whether the health facility in which they are training has a quality improvement program, and if so, are they able to observe or participate in it? By doing so, students may be able to understand the significance of quality improvement. The team's efforts won't be rewarded by actual, long-lasting gains in healthcare unless these methods for quality improvement and tools are put to use.
In a healthcare setting, collaborative practice refers to the delivery of comprehensive services by a group of healthcare professionals with different professional backgrounds while maintaining the highest quality of patient care across a variety of settings in working with patients, their families, careers, and communities. Certain behaviors and attitudes are considered necessary, such as coordination, cooperation, shared decision-making, and partnership, all of which together make up collaborative practice. Why is interprofessional collaboration so important in the field of healthcare? Because when you build collaborative culture and put communication strategies and technology as a support, you improve patient care and outcomes, reduce inefficiencies and healthcare costs, as well as reduce medical errors.
In engaging with patients and carers, we should provide them information about the quality of care they will receive, especially if they have to have invasive intervention.
With patient consent, family members and carers should also be included in the exchange of information. Informed consent allows patients, in collaboration with health professionals, to make a decision about interventions and risks. Patients should know about the diagnosis or main problem, proposed treatment, cost, benefits of treatment, risk, and the length of the treatment. As healthcare professionals, we should always be honest, be respectful, be aware of cultural differences, and enhance the continuity of care for the patients. Lastly, engaging with patients and carers talks about common barriers to honesty with patients and tools for good communication. It includes spikes, a communication tool used to assist health professionals to communicate bad news in situations where patients are at the end of their life, and open disclosure, which is used to describe the process of informing patients and their families of the bad outcome of treatment.
Infection control is very important in the healthcare settings. Without proper infection control techniques, for example in the dental clinic, a patient and instruments or machines can be carriers for cross-contamination and contribute to the spreading of bacteria, viruses, and diseases such as HIV and hepatitis B/C/D.
Nowadays, the spread of infection in healthcare settings already affect hundreds of millions of people worldwide. The World Health Organization defined a healthcare-associated infection as an infection acquired in a hospital by a patient who was admitted for a reason other than that
infection or an infection occurring in a patient in a hospital or other healthcare facility in whom the infection was not present or incubating at the time of admission. Healthcare-associated infections are caused mainly by bacteria, viruses, and fungi which came from human or environmental sources. The possible routes of transmission are through direct and indirect contact, droplet, airborne, percutaneous exposure, and patient populations who are particularly susceptible to healthcare-associated infection. US CDC Universal Blood and Body Fluid Precautions has two types. The first one is standard precautions, which are applied to the care of all patients in all healthcare settings, regardless of the suspected or confirmed presence of an infectious agent, and the second precaution is transmission-based, which are used when treating patients who are known or suspected to be infected or colonized with infectious agents. According to the World Health Organization, there are 5 priority training areas for students in preventing healthcare-associated infection, which are the environmental cleanliness, sterilization or disinfection of equipment, devices, and instruments, medical devices labeled for single use, hand hygiene, and lastly, how to protect skin. Every healthcare provider should perform hand hygiene when touching a patient, before a clean or aseptic procedure, after bodily fluid exposure risk, after touching a patient, and after touching patient surroundings. In addition, from the priority trainings mentioned above, the World Health Organization also stressed the importance of using personal protective equipment or PPE, which includes gloves, gowns and face masks, head cups, and eyewear.
Common in dentistry. In view of the risk of adverse events as well as the risk of morbidity and mortality, healthcare providers constitute a context of high risk in a crucial aspect of patient safety.
The patient safety paradigm starts with the proper assessment and identification of specific dental-related safety factors, such as the effectiveness of communication and exchange of critical patient information, the operation of patients at the correct site, individual or group values, competency, and proficiency. Communication between surgical patients has to be even more precise ahead of the anticipated surgery, because poor communication can lead to surgical delays, patient inconvenience, and serious errors. Typically, when an adverse event occurs, it is usually simultaneously associated with latent risk, despite the genuine concern for patient safety that is inherent in the practice of healthcare. Patient safety is quite complex in nature, and thus it cannot be elucidated in the provision of safe surgical healthcare. The World Health Organization has commenced to improve various strategies as apparent to the patient's safety. According to them, improving teamwork and communication is one of the main goals of using a checklist, which appears in the conclusion of the study and indicates the pre-operative briefings and post-operative debriefing contribute to those improved processes and outcomes, where its main scheme is to avoid the eventuality of preventable adverse events.
Medication plays an important role in managing diseases, but it also can be quite harmful if used incorrectly. It has been proven to be beneficial in treating and preventing diseases. Medications, on the other hand, can also lead to hazards when taken incorrectly.
Medication error, according to the National Coordinating Council for Medication Error Reporting and Prevention, is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of a healthcare professional, patient, or consumer. The medication error may result to an adverse event if a patient is harmed, a near miss if a patient is nearly harmed, or neither harm or potential for harm. Medication error commonly occurs in prescribing stage and are often associated with the health professional's inexperience and lack of knowledge about the medication, failure to follow an agreed upon protocol, or other factors such as tiredness and lapse of memory. Medication error may also occur when consumers self-prescribe drugs and misuse OTC counters or over-the-counter medicines. Drug consumers should always seek advice from medical professionals when they intend to use certain medications.
There are a lot of events lawyers can collaborate with professionals in varying fields. Lawyers can help professionals in protecting their practices, handle litigation, and dispute with patients, members of the team or colleagues, and other legal transactions.
Number 1. Hiring associate dentist. Number 2. Buy out a dental practice. Number 3. Lease a commercial dental office. And lastly, contract making or dealing handling with different contracts and agreement in dental practice or involving other parties.
Thorough scanning, I see that care and care coordination are broad, interrelated, and at times overlapping concepts that make significant contributions to how people experience health and care.
They are global priorities for reorienting health services towards the needs of people. Practice interventions that improve the continuity and coordination of care will invariably improve the care experience of people who require chronic support, enhance the experience of providers, improve health outcomes, and increase health system performance.
Now remember this scene. Treatment fails due to the lack of the needed members in order to render the treatment holistically. If interprofessional approach is employed, then the dentist should first collaborate with the physician in order to know the underlying systemic diseases of the patient, and also must be collaborating with other professionals like dietitian, pharmacists, and others.
So keep in mind that we need to take interprofessional approaches to patients seriously.
And must be practiced in the field diligently
to ensure that patients receive the best treatments in our hands.